AmpuShield donning and doffing. AmpuShield post-operative limb protectors are an important part of your patient's recovery process, protecting and encouraging healing at the site of amputation. To help ensure the correct application of AmpuShield and optimal outcomes for your patients, please keep in mind the following instructions for donning and doffing the device. Donning the AmpuShield. When donning AmpuShield, start by always applying a sock to the patient's limb prior to fitting the device. This will help to protect the patient's skin. Next, loosen the straps and open the device. Gently guide the limb protector onto the patient's limb, making sure the patella sits in the middle of the anterior opening. Next, secure the large black cover over the distal end, making sure it's snug but not overly tight. Then, gently secure the proximal straps. They should be snug but not overly tightened. If the straps are too loose, it may cause the AmpuShield to migrate distally. Finally, gently adjust the sock so it lays flat against the patient's skin. Roll the sock down over the proximal aspect of the AmpuShield to ensure the sock does not migrate down. Doffing the AmpuShield. When doffing AmpuShield, start by rolling the sock up over the proximal aspect of the AmpuShield for better access to the limb protector. Next, loosen the proximal straps and the distal pad completely for easy removal. Then, simply open the device and gently guide the patient's limb out of the device. Remove the patient's sock to access and inspect the limb. It is also recommended to clean the AmpuShield during regular dressing changes. AmpuShield limb protectors can be worn 24 hours a day, depending on each patient's condition, but should be removed 1 to 3 times a day for wound inspection and range of motion exercises, where indicated. Never use AmpuShield without applying at least one sock over the patient's skin. Wearing the device too tight or too loose can cause complications. Important additional items. It is important that the distal residual limb is supported when sitting, and any complaints of discomfort are addressed early. If the patient complains of excessive tightness, pain, heat, or throbbing, remove the limb protector to inspect the wound for any signs of infection, and check to see if the AmpuShield is overly tight. Rotating or adjusting the position of the device or loosening the straps may be necessary. If the device seems too large or too small, the patient's limb or the amount of dressing material may have changed. Add or remove socks to compensate. If you have questions, contact your Hanger Clinic prosthetist. Visit hangerclinic.com/AmpuShield to learn more. And for more video resources, please like and subscribe to our YouTube channel.